Hi, I'm Courtney Mears, and I'm a doctor of physical therapy and a board-certified orthopedic clinical specialist. Let's answer some questions from the internet. This is Physical Therapy Support. @Schminkster asks, how long does physical therapy last? This is a really broad question. My patients, I typically see them around 6 to 8 weeks, give or take. The fix after physical therapy, it really depends on how good you are about your home exercise program, how long you typically decide to stick with it. And again, just depends on what's injured, what are you trying to get back to, and what your functional goals are. @Fully Loaded asks, I'm going to ask my PT tomorrow, but are physical therapy and rehabilitation exercises supposed to make your body parts ache? Every time I do them, it hurts more. Typically, whenever you're given something new, it might hurt a little bit, or you might be a little achy here or there, but all of that's very normal. Just like if you did a little workout that you've never done, sometimes you're a little sore, maybe for like a day or two, but then it should get better over time. A lot of PTs use that 0 to 10 scale, so you'll see 0 means I'm in no pain, 10 means, oh my gosh, I have to go to the emergency room. And so you could typically be around like a 2 or a 3, and then we're good to go. @Kurt2Dope asks, why does physical therapy include so many science classes? That's because what we do is science. A lot of what we're doing involves a lot of physics. We have to understand different pharmacological interventions, which involves a lot of chemistry classes. A lot of us have to, think about the research side of things, so you have to be able to analyze and understand a lot of that information. And everyone now coming out of a physical therapy school is earning a doctorate, so they're just taking you to the next level to make sure you have a really wide understanding of what you're doing with patients. @Jay's Your Drug asks, does physical therapy really help with having a bad back? So if we look at this, there's a lot going on with the back. I don't ever tell people they have a bad back. Everyone looks a little bit different. When you go to PT, they can tell you, is it actually your back? Or is it your hips? Or is it something completely different? I think physical therapy helps with pain and with function. But again, I don't think anyone really has a bad back. This thing is so cute. I love her. @StarKillerKOF asks, so how does physical therapy work? Do I go somewhere to do it, or is it a thing that you do by yourself at home? Nowadays, it could actually be both, just because we have so many more options out there with the use of telehealth. But I would say you have 2 different ways to go about it. You're gonna be able to go into your standard clinic and be one-on-one in person with your PT, or you might be through the screen going through them with exercises or what can you do in your home environment. But in both situations, you're gonna be with somebody, not just by yourself. You'll always get homework, I think. You'll always have something to do. You're obviously going to a PT because you're looking for help, but in order to make it last, you're gonna have to put in the work by yourself too at home. @PhysioT06546448 asks, what is aquatic therapy? This is really PT in the water. So you're in the pool. Typically, a rehab pool is heated, so it's a little bit different than your community pool. The water gives you some type of compression, but the water also gives you a lot of support. So for some people, you want to be unweighted, so it loads you a little bit less, and it makes you just a little bit more comfortable to move. But even if you're in the water, we're typically asking people to then do everything you learned there on land, because we're not fish and we have to be able to do things on land anyways. This might be my chronic pain patient or my older patient. So maybe they have a lot of arthritis in one of their joints and they just need to unload that joint a little bit. And so this just allows them to be more comfortable but get the movement that we're trying to achieve. @CompanionRag asks, I think I need physical therapy for my jaw or something. The pain is getting consistent and unbearable. TMJ tips welcome. Most people don't realize that PTs can treat jaw pain. The jaw is a joint just like any other part of your body. You have muscles that are around it just like any other part of your body. Typically for a lot of my patients, I prescribe them some soft tissue work. So we'll be working like a little bit of massage through these big muscles here. If you can find out how to relax your jaw, that's gonna be the number one. So what I tell people is tongue on the roof of your mouth, teeth slightly apart, lips closed, and see if these can relax a little bit. And if you can get that throughout your day, you're gonna be golden. If I was gonna be doing a self-massage at home, I typically try to find this really high bone up here at my cheek, and then I find my jawbone here at the bottom, and this is where I'm gonna be doing my soft tissue work. If you're clenching down, it's not gonna work because you're just gonna be fighting yourself. So again, you wanna be relaxed, and you're just gonna kind of push and pull, push and pull. At You Don't Need to Know Why asks, how the hell does physical therapy fix a pinched nerve? A pinched nerve really just means that there's some type of pressure on the nerve. A lot of the times what I see is posture related. So if people are really hunched over or moving a little bit different, it can put pressure on different parts of the spine and those spinal nerves. Strengthening, if they're really, really weak, either through their back muscles or maybe their core muscles, but it doesn't fix the pinched nerve. It just helps give you support all around it. Nerve symptoms present as numbness, tingling, burning, but it could also just present as pain. When we look here at the spine, all of these little yellow lines are nerves that are coming out. For some people, these spaces that these nerves come out of are a little bit smaller, whether that be from arthritis or if they've had a disc herniation. And physical therapists are there not only to help treat this, but to help you compensate if we need it. Because we don't fix what your bone does, but we might be able to help you move better so that you don't make that nerve angrier. At Neha Patel DC asks, did you know that physical therapy isn't only for the injured? Physical therapy sessions can also help athletes become stronger and more injury resistant, thus allowing them to perform better than they normally do. Absolutely true. I think where physical therapy is going isn't just for people who are coming in for injuries, but really trying to prevent an injury. Every population, every age group, everybody could use a little TLC to their muscles or their mobility just to make sure you're living the best life you can. At iAdministrative197 asks, MCL grade 3 tears. How long did your MCL take to heal? MCL, if we're talking about the knee, it's your medial collateral ligament. It gives you some stability around the middle part of your knee to prevent it from, feeling unstable. Depending on the grade of tearing, MCLs don't heal on their own. Grade 1 is just a little bit of stretch. Grade 3, now we're seeing a little bit more tearing, a lot of stretching, and it just means that our process in PT might take a little bit longer. If you have a sprain where it's stretched out, maybe you can get some support around your joint to make it feel better, but it doesn't necessarily mean that the tissue itself is healed back to 100%. You might have a little bit of scar tissue now, you might have a little bit more of an odd movement pattern, but this is where, if you can go to a PT as soon as you can so we can fix those things, it just puts you on the track to success a lot faster. At 7 Spring Days asks, I need someone to explain the difference between occupational and physical therapy to me like I'm a 5-year-old. Our professions are very similar, but occupational therapy, when you're at point A and point B, they'll help you do those activities at those points. And then if I'm working with a PT, they're gonna help me get from point A to point B. If you weren't a 5-year-old, I'd say a PT really helps with the gross motor skills, strength, mobility, flexibility, and OTs might be working with you on more fine motor tasks, but both are gonna be helping you back to your activities of daily living. At Gad Sunter asks, physical therapy versus gym personal training. Both of us do exercises with people, both of us correct how movement is being done, but I like when people see a PT first because then they can really get down to the nitty-gritty. Like, what should I really be doing to get back to this goal? Or how can I do XYZ safely by myself? And then maybe you go to the gym, you know exactly what you're doing so that you prevent the injury from happening. That way you don't have to end up at the PT anyway. At Memento Quest asks, did you know physical therapy strengthens your muscles, but what about your brain? Anytime you do any type of movement, you're creating these new pathways in your brain. This is what we call neuroplasticity. And when you learn a new motion or how to correct something, you're getting all those pathways going and you're just enhancing the way you think. So you really aren't just strengthening your muscles, you are strengthening your brain, all of your cognitive abilities. And there's also other portions to PT where maybe that's all they focus on. One of them is neurologic specialty in physical therapy, and they're really working with the nervous system. So some people have changes in their brain. Maybe they've had a stroke. Maybe they have a neurologic disorder like Parkinson's. And so what PTs in that specialty do, they're really working on rewiring the brain to help with their balance, to help them with their motor function, to get them back to what they want to do too. At YRS asked, does VR physical therapy exist? Definitely. A lot of people are now using this, and we see it being used to help people with their balance. So they're putting them in a different environment with one of those really big headsets, and they're trying to get them to reenact how they would be walking down the street, or if someone came up right in front of them and they have to react to move. But other specialties are also using this to help people relax and help calm their nervous system down. A lot of our chronic pain patients are using this nowadays, and a lot of great research is coming out about it. At MRCNNS1 asked, do you recommend blood flow restriction training? First, the person has to qualify for this. So if you had something like a blood clot, you're not appropriate for this, definitely not. But a lot of patients do benefit from this. And what blood flow restriction training is, so we take one of the limbs, whether it's the upper body or the lower body, we put a really big blood pressure cuff around it, we pump it up, and it restricts blood flow. What that does is it creates this environment for muscles to grow faster, what we call hypertrophy, and you're also able to do more with less. And so this is really nice for people who don't tolerate really large loads, but you still want to get more muscle growth, better endurance, and again, better outcomes. A Reddit user asked, to what extent can psychological anxiety lead to chronic physical symptoms? So there's a center in your brain that processes what pain is to you. And this little center, if everything is very heightened, like for those who experience anxiety, might light up a lot more than for your typical person. When everything's heightened, something like a loud sound can feel a lot different to that person. While I see a lot of these people, it's usually a multidisciplinary approach. So they might be seeing somebody like a psychologist or a mental health consultant, just to make sure that we're both addressing their needs. But it's really this like balance of how we address it. It's definitely not just in your head. At Mitch Liu asks, how do physical therapists always know when you aren't doing the stretches at home? Hashtag called out. When I have my patients, I'm always testing them right when they come into the clinic. I'm asking, well, show me what you did last time. And if one, they don't remember, I definitely know they didn't do it. But two, if we aren't getting where we're supposed to be, I know something's going on, and it just has to be called out. We do catch everybody. At PDig917 asks, ice or heat? Big question in physical therapy. I would tell people if they're immediately post-op, so they just had a surgery, ice is probably a better option because they probably have a lot of swelling, a lot of inflammation, and we're really trying to get things to calm down. But if you're someone who feels really tight all the time, or like your muscles are just stiffening up and your joints are stiffening up, and you've been experiencing that for years, heat might be a better option for you. At the end of the day, it's really what you prefer. So if it's the winter for me, I'm usually not choosing ice and I'm going heat. At PowerArm asks, PT perspective on cortisone shots. Cortisone is an anti-inflammatory, so if you have a lot of inflammation in a specific joint, and if you can't move because there's not a lot of space, you're probably gonna be in some amount of pain or dysfunction. So when you get the cortisone injection, it just, again, helps everything calm down so that we can get you moving a little bit better. A lot of what we do in PT is really helping that person load a specific tissue, but if that tissue isn't ready to be loaded, then we're just gonna be at a standstill. At DH Dunkson asks, what is the difference between physical therapy, physiotherapy, and sports medicine? Physical therapy and physiotherapy, same thing. It just depends on what country you're in and who's talking to you about it. But the difference between physical therapy / physiotherapy and sports medicine is the broadness of what you're able to practice. Sports medicine deals with athletes and a more active population. So it could be your high school athlete who's playing recreational soccer on the weekends, but it could also be your professional athlete who's in the NHL. Physical therapy has a much wider range on what we do and who we treat. At Risk Everything asks, how much of physiotherapy is pseudoscience? So I think in any profession, there is some type of pseudoscience, but for what I do and how I practice, I'm always going back to the research. I'm never just, shooting from the hip here. Whatever I'm putting into practice with patients, I'm making sure that it's been tested and it's tried and true, and that ultimately it works. Because there's a lot out there now in our profession that we know about in relation to stretching, strengthening, manual therapy techniques, and we know what the best intervention is for the right person in diagnosis. At Alicia Gaxi 92206 asks, how do you stop peeing yourself every time you sneeze, cough after giving birth? Asking for a friend. So you have muscles within your pelvis. It's your pelvic floor. Those muscles, just like any other muscle in your body, need to be trained. After giving birth, a lot of these muscles are getting relaxed because of a different hormone that you're producing to get ready for birth and open up your birth canal. After birth too, sometimes you have different structures in your spine that are also a little bit more relaxed, or they're just being used a little bit differently. So if you feel like you're a little incontinent, definitely hit up a physical therapist to get seen and to get treated for it, because it's not something that you have to live with. At Amir Exists asks, why are physical therapy stretches so much harder than lifting weights? Great question. It's probably because your PT's isolating the exact muscle, and when you're at the gym lifting your weights, your body's taking the path of least resistance. So it's always good to see a PT just to make sure that you're hitting the exact right spots. At Eric Robertson asks, how is cupping therapy actually part of physical therapy? Why not herbs? Why not magnets? And why does cupping escape scientific scrutiny? I don't think it escapes scientific scrutiny, because even I'm a little bit hesitant to use this with people. This is a therapy that we might use because it's readily accessible for a lot of people. You can buy a set on Amazon for $20. So instead of going to PT, maybe this is something you can do in between. Typically, you're right. It's like a Band-Aid on what we're trying to complete, but if it makes you feel better, why not? At Joey Giggles asks, how does mirror therapy work? Mirror therapy is really trying to almost retrain your brain to not be in pain. Typically what we're doing is we're putting a mirror near a limb or body part that person is interpreting with their brain as normal, and we're trying to make that connection in their brain that the other side is also okay. At Poo Poo Sandwich asks, who invented physical therapy? Some guy was just like, hey, let's move his arm the complete opposite way and see what happens. So there's a couple different theories out there for who started physical therapy and how he became to be. During the polio pandemic, someone was like, hey, I want to get people back to moving who are really weak. And what she did was actually aquatic physical therapy. So that's how our profession got going. And once we realized that people who move do better, we just kept growing and growing, and now we do it all. At Eleanor 95670977 asks, how do physical therapists help treat patients with pneumonia? It's not my specialty, so I don't typically treat this, but there is chest physical therapy. So they use different percussive techniques, and typically their hands are like this, creating little cups, and they're pushing and pressing on little parts of the lobes of your chest to help all those secretions that might be coming from pneumonia dislodge so that you can be able to cough them out. At L Growing Bones asks, how does yoga assist in physical therapy? So I think yoga has a lot of great qualities. A lot of people are doing yoga to be stronger, to gain more flexibility. And this can be really useful in PT because we're working on a lot of the same activities. Yoga is usually the activity though that I'm helping people get back to. So I'm working things maybe in more isolation to help them get back to their goal of a certain yoga pose, or to be able to tolerate a single leg stand while they're completing a tree pose. But if you're stretching that much and not strengthening, you're gonna be unbalanced and your body is gonna be a little bit dysfunctional. At Joel Martinez asks, well, that was a new experience in physical therapy. They use this thing that looks like a dull knife to break up some scar tissue and fascia. Let's see how this feels later today. Some physical therapists use metal tools or plastic tools, and they really are scraping the tissue. The research behind this is a little spotty, but the idea is that you're creating a type of micro trauma to that tissue, which increases blood flow. And when you increase blood flow to an area, that helps heal tissue and get nutrients to it so that it heals faster. At Kitty Plays asks, anyone have experience with a TENS machine? Got my first one today, and so far it's working to relieve my pain. Awesome. Would love to know any tips and tricks on how to use it. A TENS machine is a transcutaneous electrical nerve stimulation machine. There's little sticky pads that you'll put on different parts of your body, and the machine sends an electrical current to that pad, which stimulates muscle contraction or nerve stimulation where you might feel a slight buzz or just a different sensation. Essentially what we're trying to do is modulate pain. So when you feel that buzzing or that twitching, it's sending that signal up to your brain and it's telling your brain, think about this, and it beats the pain signal. So when you're using it, I'm glad you're getting relief in your pain because that's exactly what it should do. At Personalized Milk asks, who wants to hit me with the Epley maneuver before I throw up? So the Epley maneuver is used for people who are experiencing dizziness, specifically those who are experiencing dizziness due to benign paroxysmal positional vertigo. Most people just call it vertigo, but that's the long name for it. There's crystals in your ear, and sometimes those crystals get dislodged, which is what's causing people's dizziness. So what this maneuver is trying to do is put that crystal back into place, thus leaving you dizzy-free. At SN1 asks, LOL, over 40 and your back hurts from just lying down too long. It's like your body goes, oh shit, we're getting up. Yo, I thought you were dead, and I'm not gonna lie, I just stopped working. Hold on, I'll fire back up. As we get older, we get a little stiffer. We become a little less flexible. So when you don't move, there's no joint fluid that's lubricating a lot of your joints. And when that happens, things feel a little creaky. So then when you get back up, you get that joint fluid, you're lubricating all the joints that you have, and then you're feeling good as new. If you're feeling a little stiff when you wake up in the morning and you're in bed, just move your knees back and forth just to get things again lubricated a little bit. Or if you're sitting and you're really hunched over, just try sitting up nice and tall, and maybe you're doing a couple shoulder blade squeezes to lubricate those joints back there and just correcting your posture in general. At MB Rose asks, I wonder when people are gonna start wearing Kinesio tape just to look cool in sports. Kinesio tape is this stuff. It's a flexible tape that we've probably seen a lot of athletes wear. It kind of stretches. The idea behind it is that it's lifting some of the tissue to increase blood flow to an area, but some people also use it to feel a little bit more support when they're completing an activity. Typically, I don't use this too often, but you do see it a lot out in the public. There's different prints out there. Some have a camo print, some have different stars or hearts on it, but it all does the same thing. At P. Coleman 84 asks, can physical therapy help with scoliosis patients, or is surgery the only tool? Surgery is definitely not the only tool. Some people have scoliotic curves in their spine and they have no pain. And some people have really large scoliotic curves that we have to help different muscles stretch out or different joints kind of loosen up. But we can definitely help with this, and surgery is definitely not your only option. At Braden Weiss PT asks, did you know that physical therapists can treat pain in limbs that have been amputated? Physical therapists have developed many techniques for treating phantom pain. So some people, when they have a limb amputated, their brain still thinks it's there. Because your brain is interpreting that the limb is there, it's sending signals and creating pain in something that is no longer. So what mirror therapy does is it's having you look at the limb that still exists, and it's retraining your brain to thinking that the limb that doesn't exist anymore is absolutely okay. So you can think of this as kind of like a brain game retraining. Okay, that's all the questions for today. Thanks for watching PT Support.